Welcome to the Making of Me podcast, where we explore the defining moments and challenge that shape who we have become. Today, we are joined by Dr. Julie Simia, nurse, educator, patient safety experts, and founder of LifeBeat Solution. Julie has spent over 30 years inside hospital, witnessing exactly what goes wrong and why. She is on her mission to help patients and families stay safe during hospitalization. It's really a pleasure to have you on the show, Dr. Julie.
Thank you. Happy to be here.
Yeah, thank you. So, Dr. Julie, what were some of those challenges that shape you into who you are today?
Well, being a nurse for so many years, and then when I started my master's degree program back in 2009, and focusing on the topic of patient safety and finding the research and statistics was just so alarming to me that so many patients suffer harm in the healthcare system. Like I said, I'd been a nurse for a long time and had no idea the extent of the problem. So that spurred the desire in me to help nurses as well as helping patients and their families so that we can start decreasing those numbers of patient harm in hospitals.
Yeah, amazing, amazing. Thank you so much. So, what inspired you to move from our bedside nursing to patient safety or advocate and educator?
Yeah, so I moved from bedside nursing to nursing education, and that's where I felt like it was a great opportunity for me to share my knowledge, but also identify those gaps in nursing curriculum, but also in nursing knowledge, nurses that were already out there practicing nursing at the bedside, which was my impetus to create the courses for nurses and then write my book for patients and their families.
Amazing, amazing. So, how can our patients and family prepare before a hospital stay to minimize risk?
One of the best things, at least in America, that a patient and their families can do is to research the hospital in your area. There's a website called hospitalsafetygrade.org where you can put in your zip code and find all of the hospitals in your area and find out which ones are graded A, which is excellent, all the way down to an F, just like high school, college grades. So you can also dive in and in the 32 categories, you can see how the hospital is doing in that specific category. It's really easy if it's red, yellow, or green. And if they've got gaps of safety, then you can specifically have a conversation with your doctor or that hospital to say, I see that your infection rates are not really good. How are you going to help keep my mother safe from getting an infection in your hospital? And then you can make sure that everybody that comes in the room to care for your loved one, make sure they wash their hands. It's that simple.
Amazing, amazing. Thank you so much for all you do. Thank you. So, what were some of the most common mistakes hospital make that people don't realize?
Well, communication breakdown is the number one cause of patient harm events. So that can come in multiple forms, but for example, it would be having a result of a test, whether it's a biopsy of your tissue, whether it's a lab test, whether it's an x-ray, having those results come back abnormal and nobody telling the patient. That happens more than we think. It also includes the communication between doctors. They forget to pass on certain information about the patient that does impact safety. I also put in there, it's the failure of patients' family members to speak up to the healthcare team and say, for example, hey, my mom is really confused. This is not like her. Even though she's 70 years old, this is new for her, and I think we need to investigate. So patients and families aren't used to speaking up to the healthcare team. I think for overall, they've taken a very passive role in thinking, well, the doctor's got 12 years of medical school. The nurse has 4 or 5 or 6 years of training. I know nothing. I'm just the family member. But that's not true. You know your family member better than anyone. So communication is so essential. And I suggest writing things down because it can be overwhelming. You may have one doctor come in and say, this is what we're going to do. And then another doctor do something different. And you need to speak up and say, help me understand. This was the plan and now we're changing the plan. Can you tell me why? That's within your rights. But I think the second, probably most common harm event that occurs in hospital is medication errors. So nurses are taught in school. There's minimum of 5, some teach more, of medication safety steps. So is this the right patient to start with? Is this the right drug? Is it the right dose? Is it the right route? When they need to go through those questions every single time they give a medication to a patient. But many times they will take a shortcut, and that's where harm can occur. There's unfortunately many instances of patient harm, but also patient death when they're given the wrong medication or it's to the
Yeah,
wrong patient. Yeah.
yeah, amazing. Yeah, thank you so much for this. So, how can patients speak up in the hospital without being dismissed? Why is this skill so important? Because I know sometimes, as much as one my patient is willing to speak, how can one communicate effectively without sounding out dismissive?
So, one of the tools that I teach, and I talked about this in my TEDx talk, How Not to Die in the Hospital, but is to use the cuss words. So, cuss, concerned, uncomfortable, scared, and a safety issue. So if you start your conversation saying, I'm really concerned about my dad, he's in way more pain than is expected, or he's already had pain medication and it hasn't helped. And so that gets the attention of the healthcare team when you use one of those words. I'm uncomfortable with how my dad looks, or I'm scared that something is really wrong with my son. And having the courage to speak up, because if we stay silent, that's when patient harm can occur. And so even if you do get dismissed, there is a chain of command. So at least in America, we have the bedside nurse, we have a charge nurse, we have a house supervisor, we have the medical chief of staff. You know, there is a chain of command that we need to use when we're not getting resolution. Let's just say the nurse taking care of your mom says, oh, this is pretty normal for post-operative, whatever, and you're like, no, something's not right, then you just need to escalate your concerns.
So you have actually created more like a patient safety checklist. What are the top things everyone should ask and know before the surgery or admission?
Yeah, so know your hospital rating. At least if you're in America, you can look those up. I would also do research on my surgeon, because there are some surgeons who don't have a very good track record. And of course, nobody will ever tell you that. You have to do your own research. That's what I would definitely do. I would also make sure that you understand the potential complications if you're planning surgery, which many surgical cases or post-operative complications are respiratory or breathing problems. Pain management can be a problem. Blood clots can happen, especially with a longer surgery. And so you need to ask those questions when you understand what the potential complications are. How are you going to help me avoid getting a blood clot after surgery? Because there are preventative measures for every one of those.
Yeah, amazing, amazing. Know your hospital rating, know your surgeon, and also ask about the potential complications that will happen when that particular treatment is being followed. Yeah, amazing. Thank you so much for sharing. So, how do hospital staff, burnout, and systematic issues affect patient care, and what can family do to prevent themselves?
Yeah, well, I know burnout occurs in the US at quite high rates, especially after COVID. It doesn't seem like it's gotten a whole lot better. And it's understandable. The nurses are working short staffed in many hospitals, and that gets exhausting. That's part of the problem. I know we don't have quite enough nurses, or hospitals aren't hiring more nurses because their reimbursements are decreased now and they're barely surviving on their operating incomes. And so, yeah, it causes a lot of stress. So from a family perspective, understand that a nurse may be trying to do his or her best, but they have 5 or 6 or several other patients who may be as critical as yours, or if your family member is pretty stable but they're hurting and need their pain medication, unfortunately it may take a little more time to get it than you would hope. So it's just being compassionate for the working situation of healthcare providers, but also being firm but kind. I say the 3 Ps: be present, be polite, but be persistent when you have an issue you need to bring forward. So being present means be there at shift change if you can, because then you can hear what the offgoing nurse or doctor is saying. And if they miss something, you can help fill it in. But remember, my dad got dizzy when he stood up out of bed today. That's important. If the new nurse doesn't hear it, then dad may fall because they're not being helped. So be present for any kind of communication or when the doctor's making rounds. That's really helpful too. And take your notes, like I said.
Yeah, amazing. Being present, being polite, and being persistent. Yeah, amazing. So finally, what is the key mindset or approach that help patients feel empowered, not fearful in a complex medical situation?
And it is complex, that is for sure. Say it's very similar to being in a foreign country. Medical language is different. Most of us don't know what the word erythema means or pulmonary infiltrates or any of those kinds of things. So the language is challenging. But I think if we can become informed and educated, and we're very lucky, we live in a day and time where we have resources to become informed and educated. I have a lot on my website to share with patients and families. And again, why I wrote the book. But I think when you empower yourself, when you get informed and you get educated, you empower yourself to speak up and just learn about let's just say your mom has pulmonary disease, then learn about that. So you know what intelligent questions to ask and then have a dialogue with the healthcare provider. I think that's the best thing you can do. We can't rely on healthcare providers to know everything. There's just too much medical information. And most of the time, they don't have time to update themselves on the latest surgical techniques or the latest medication treatments or whatever, right? So just become informed, educated, and ask questions and be an active participant.
Yeah, being an active participant and keep asking intelligently. Amazing. So Julie, what is going to be more like a takeout for my audience once they get your book, so that yes, they'll be inspired to actually get it? Being that I think all the discussion we make references today, we're actually more like exploring the content of the book. So I would love to just talk to them more about your book.
More about the book?
Yeah.
So it's about 18 chapters, and I took my years of experience at the bedside and my years of teaching to determine what I felt were the biggest areas of opportunity or things that patients and families should learn. And then I provided stories. There's about 30 stories in the book, and unfortunately, they're all true. And I say unfortunately because most of them had significant harm or died. But I think stories really speak to people where they can put themselves in the same situation. If my dad was, this was happening, if my dad had brain tumor surgery and we didn't hear the results and we assumed it was normal because nobody called us, when you read the story of that happening to one of the patients, you'll never not pick up the phone and get confirmation, right? So I think stories help teach, but I tried to cover patients' rights, how to choose your hospital, like we talked about, how to choose your healthcare provider, your physician, what are vital signs and why are they so important? Because they do tell us about what's going on with the body, especially baseline and trends. Those are really important to understand. And so just different areas that would impact the patient's journey through the healthcare system.
Yeah, amazing. Thank you so much, Dr. G. And Dr. Judy, for my audience who want to learn more about you, how can they reach out and where is the best platform?
So my website is drjuliesiemers.com, and I'm sure you can link that, right?
Yeah.
And my book is on Amazon. My social media, where I do a lot of patient teaching, give case studies so people can learn from those case studies too, is Dr. Julie Siemers on TikTok, on Instagram, on Facebook.
Yeah, amazing. Thank you so much, Dr. Julie. Thank you for sharing your insight, our stories, and practical tools for keeping patients safe. Your work reminds us that even in the system that can fail, we can act with knowledge, advocacy, and care. Listener, you can download our Julie's free patient safety checklist and learn more about protecting yourself and your loved ones. Check out drjuliesiemers.com. Which the link is going to be on the show notes. Thank you for tuning into the making of me. And once again, it's really a pleasure and honor having you on the show, Dr. Julie.
Thank you. I appreciate the conversation.